Hi, I'm Jonathan Reyes. I'm a second-year physiotherapy student.
Hi, my name is Chris Koskaletos. I'm a second-year physiotherapy student, and today we'll be working with you for any questions you have. What brings you in today?
Hey guys, I have a couple of questions regarding fibromyalgia.
Oh wow, what are those questions?
Well, what is fibromyalgia?
That is a perfect question for my colleague Bertrand Lim, who is the cameraman. He'll answer that question for you.
I sure can. So, you want to know what fibromyalgia is? Well, it's a chronic disease which results in widespread muscular tenderness and pain throughout the body. Individuals with fibromyalgia typically report this as a consistent, dull ache, equally affecting both sides of the body.
Are those individuals able to sleep properly at night if the pain is constant?
Well, this dull ache often carries into the nighttime and disrupts the individual's sleep schedule. Patients often voice complaints of chronic fatigue as a result.
Wow, it must be hard to work under these conditions?
Indeed it is. This fatigue does make it quite difficult to function in a daily routine. Another symptom which may stem from this chronic fatigue is referred to as fibrofog. This impairs the individual's ability to focus, think, form memories, and overall reduces their mood.
Oh my Lanta, that sounds mighty awful. Is there any other symptoms with fibromyalgia?
Well, although these are the main concerns, others report symptoms including morning stiffness, headaches, tingling in the feet and hands, as well as painful menstrual periods.
And what causes fibromyalgia?
Well, for this next question, I think our buddy Johnny Reyes here can answer that question for us.
Well, currently the research states that fibromyalgia is a disease of unknown origins. Scientists speculate that several factors may play a role in this diagnosis. Firstly, genetics seem to play a significant role. Genes involving the chemical production of serotonin within the body are typically altered. Fibromyalgia also tends to run within families, which further proves that genes may play a role. Secondly, there are also environmental factors such as viruses, illnesses, repetitive injuries, and traumatic events. Traumatic events may include physical events such as car accidents and psychological trauma such as sexual abuse. Thirdly, the presence of other diseases such as rheumatoid arthritis, lupus, and spinal arthritis may contribute to the development of this disease. Finally, fibromyalgia may just develop on its own without any of the aforementioned factors.
And what is the prevalence of this disorder in Canada?
Overall, 3% of Canadians are affected by fibromyalgia. According to the Arthritis Society, 80 to 90% of the Canadian population affected are females. Symptoms begin to appear by mid-age. It is unexplained as to why females are more affected.
How is fibromyalgia diagnosed and what is the prognosis?
That is a great question, and I think my colleague Chris Koskaletos will help us answer that question.
Absolutely. All right, so your question was on the prognosis of fibromyalgia, correct?
Right.
Absolutely. So fibromyalgia is diagnosed based on the presence of aforementioned symptoms and widespread pain lasting for more than 3 months. There are currently no laboratory tests to determine the presence of fibromyalgia. In terms of prognosis, this is a chronic disease which never truly heals. This disease, however, does not have any impact on life expectancy. Severity of symptoms can be predicted based on age, psychological distress, coping methods, mental health, and medication dependency. The prognosis improves with adequate lifestyle management and medication regimen. Getting enough sleep, appropriate exercise, eating a well-balanced diet, and energy conservation strategies help with optimal functioning. Medications often prescribed with the intent to reduce pain and improve patients' sleeping schedule. Medications include pain relievers, antidepressants, anti-seizure drugs, and muscle relaxants. Research has begun experimenting with cannabinoids for the treatment of fibromyalgia.
And what kind of interventions would physios such as yourselves be doing?
As physiotherapists, our main role is providing information just as we did today, as we gradually return the patient to physical activity. It's important we collaborate with the patients in picking an activity that they enjoy so they may continue this exercise in the long term. This type of activity does not really matter as long as we get the patient moving, since fibromyalgia does affect the central nervous system.
I've heard Lady Gaga mention allodynia and hyperalgesia. What does that mean?
That's a great question. I believe my colleagues will be providing an example as I provide the description. So allodynia is a painful response when there is a non-painful stimulus. So this is an example of getting poked with a Q-tip and that causes you pain when that normally would not.
Ah!
That's an example of allodynia. Now hyperalgesia is an increased painful response for a normally painful stimulus. So this would typically hurt, but it's going to hurt even more this time.
Ah!
Exactly, and that's what individuals with fibromyalgia experience. Are there any other questions that you have for us today?
Nope, I think that's it.
Great, I'm glad we were able to help you today, and if you have any other questions in the future, you can come visit us again.